welcome to Queen's Perspectives Health Update. For today's segment, we're going to talk about how you can reduce your risk of getting skin cancer. Joining me here today in the studio, I have Dr. Debbie Palmer. She's a board-certified dermatologist who's going to provide us with a couple of tips on how you can protect yourself from the damaging effects of the sun. Dr. Debbie Palmer, thank you so much for joining me here today on Queen's Perspectives.
My pleasure.
Can you tell us what are some of the signs of skin cancer?
Yes, we look at the ABCDEs. So A is asymmetry, something that's not symmetrical or even all the way around. B is borders, irregular borders, something that's jagged and again uneven. C is color, so a variation in color. Perhaps there's brown or blue or red, so various colors within. D is diameter, greater than 6 millimeters, and E is evolution, so something that's changing over time. You notice a change in color, it starts to become elevated, or it's even bleeding or crusting.
And what are the different types of skin cancer?
Well, basal cell is the most common type of skin cancer, and then there's squamous cell and also melanoma.
Now, I've heard of melanoma, and I've had a couple of friends who've had melanoma. How is that treated if you do have melanoma?
That would be with an excision or to take the lesion or cut it out. It's wise to take care of it as soon as it is found. It is most common in the ages of 45 to 50, and it is the most dangerous form of skin cancer because it can travel to organs and it can spread. It can be brown or black, and it tends to, like the ABCs I had mentioned, it varies in size, the edges, the variation in color, and like I said, you can have bleeding or even crusting.
Is there an average age?
For melanoma, it's usually between 45 and 50.
Oh, okay, and I'm not eligible for any of that, thank God, right now. You can laugh. And at what age should you get a full body check then?
Well, you can do it in childhood, and especially if you have a mole that you're born with, it's wise to do that when you're young, like even the first year of life, just to keep track of it each year.
How do we protect our children from the sun?
I think that putting the proper amount of sunscreen on is one of the most important things that a lot of people don't know. It's recommended to place 1 ounce on you, and 1 ounce is about the size of a golf ball or a shot glass. So a lot of people don't use enough sunscreen, and also it's important to reapply it. So every 2 hours you need to reapply and use at least an SPF of 30 or greater.
Thank you so much for joining me today on Queen's Perspectives. That was a lot of valuable information for our viewers. Thank you so much.
My pleasure.
If you missed any part of this Queen's Perspectives Health Update with Dr. Debbie Palmer, just go to our website at www.qptv.org to hear her medical recommendations. I'm Rosa Nieves, and I'll see you next time on Queen's Perspectives. Thank you.